Good afternoon and welcome to the WAVY Digital Desk. I'm your host, Sarah Good. Today we're going to be speaking about a new study from the American Cancer Society that's saying that there's a rise in cancer for younger generations. Now they specify 17 out of 34 cancers they looked at. This includes cancers such as breast, pancreatic, gastric, and colorectal. They're talking about the generations post-baby boomers, Generation X, and millennials. They talk about how this study shows, what sort of environmental factors could have impacted this. They also talk about, what trends they're seeing, but they're also saying they don't know exactly what is causing this yet. We're going to be speaking about the rise in cancers in general today with Centera and talk about what this means. We can talk about what testings are available and more. Dr. Wilson, thank you so much for being on with us this afternoon.
Sure thing. Happy to be here.
And just a brief introduction for you. You are the medical director with Centera on the Peninsula, and you're a surgical oncologist. So we appreciate you making time to talk about some of these findings. I guess just to start, we've seen news articles, we've seen reports, we've seen studies about the detection of cancers in younger generations. But was this study surprising to you? Have you sort of seen where this was going for a while now?
No, I think it probably confirms what a lot of us have seen, that some of the trends have been recently. Certain people that we see in the media with younger diagnoses of cancer. I think this, in a lot of ways, confirms what a lot of us had seen.
And the cancers that we're talking about, breast, colorectal, pancreatic, gastric, there's obviously more listed in the study, but those are ones I feel as if, have been heavily researched, have been, heavily tested, and things have been on the horizon now, to advance testing, to advance, screening. Do you think that goes hand in hand, with what the study is saying, that now we're catching it maybe more? Is that something to do with it?
I do think that likely is part of why we see more cancer. When we do these screenings, we certainly find cancers, which is what we want, to be able to try to find them earlier. But I think there is concern that we're seeing more of these cancers in patients that are younger, and I think that's part of why you've seen recommendations for screening start to inch down to lower age ranges. So seeing certain organizations shift the recommendation for breast cancer from kind of consider to a little bit more forceful, like, hey, we really think people should be getting mammograms starting at age 40. You've seen the age drop where people used to say, all right, colonoscopy starts at age 50. Now people are saying we should probably start closer to 45 for patients that are at normal risk. So I think some of it is kind of a combination of both it happening in younger patients and us finding it more.
And we've talked about risk factors for a while, understanding maybe your family risk, understanding maybe behavioral things that could make your cancer risk lower. But now adding this generational factor in, do you think that changes how people might test? Do you think people at the testing age, we're going to see it drop even earlier? I mean, what are some of the things that you might be concerned about with patients now coming in?
I think this article is very clear about not being able to unfortunately assign, hey, this is the exact reason why we're seeing it in younger patients. But I think its main purpose is to just put it out there so that people are aware, hey, we are seeing cancer in younger patients. So we need to really be advocating for screening for those that are appropriate age for screening, and to talk about the things that we can do to try to prevent it. We know a lot of these breast cancers are lifestyle related. A lot of them can be related to the obesity epidemic in the United States. So if we can try to encourage people to exercise, to eat more fruits and vegetables, to really focus on their weight, hopefully we can see a reversal in this trend. In addition to things that we've known for years, avoiding smoking, trying to limit alcohol, etc. So I think it's really kind of just a flag that, hey, this is becoming more important, and what can we do to try to prevent it.
Right. And one of the things that stood out to me was, speaking about environmental factors, carcinogenic exposure. I think some people today, with smoke, let's say, maybe they're not smoking cigarettes, but they don't realize that, carcinogenics are present in other, types of smoking materials or the other chemicals that maybe could have an impact. There just haven't been that studied. I mean, what do you see with some of the younger people in terms of maybe devices they're using today? Do those worry you?
Yeah, I mean, I still worry about vaping. I'll be honest, I know less about that data, but I still have concerns about anything that we put into our body that's not natural, say.
And you're looking a lot in your own patients. Could you tell the audience, what types of patients you're seeing?
Yeah, I take care of a lot of patients with breast cancer and with melanoma. So those are the two that I see, and I always tell people, unfortunately, cancer is so multifactorial, as you were saying earlier. There are a lot of things that play into it. So part of it's genetic, but only about 10% of women that have breast cancer is it from a gene mutation. In fact, I think the first time I ever was on WAVY might have been when Angelina Jolie was diagnosed or had a gene mutation, speaking about that almost 15 years ago. So part of it's genetics. Unfortunately, the two biggest risk factors for breast cancer are being a woman and getting older, two things that we unfortunately can't do a lot about. But things we know that can be important are still things like exercise, being as close to ideal body weight as possible. So we know that there are those. As far as melanoma, there the biggest risk factor is sun exposure. So trying to make sure that we minimize sun exposure. We wear high SPF sunscreen if we're out during the day, hats, long sleeve shirts. We live in a great place to try to be outside, and so doing what we can to try to minimize that sun exposure with sunscreen, hats, shirts, etc. I think is really important.
And while this study might seem alarming, if you're just catching the title, you're just catching maybe the summary, what can you tell people in regards to maybe earlier screening or earlier treatments for breast cancer or skin cancer that can leave people feeling hopeful?
Yeah, we have more options for screening than we ever have. And so I think having that conversation with your primary care provider about what the best screening for you is. For breast cancer, we have mammograms. People often are reluctant to get colonoscopies for obvious reasons, but there are more options than there used to be. There are certain stool tests that can be done. The FDA recently approved a blood test that may be an option for some people, but it's really kind of figuring out based on your family history, what your goals are, what the most appropriate screening test is for any individual cancer, any individual patient.
Right, and those prevention modes that you can do, whether that's your skin check, whether that's maybe routine blood work, whatever, maybe a self-exam, how important are those steps, before maybe they get to your office, right? Just in terms of their regular doctor's appointments and regular daily, activities or chores.
Yeah, I guess I think about, the goal of screening or any of these tests is really to try to find the cancer as early as possible. So that way the treatments hopefully can be less. If we can find breast cancer small enough, hopefully it will just require maybe surgery and radiation, and maybe not require chemotherapy. It often depends on the cancer itself, so a lot goes into that. But we know that the earlier we find cancers, hopefully the better the outcomes will be, and hopefully less treatment may be required.
And we've seen new testing, and I've spoken with, other oncologists about 3D mammograms, about other testing that can be done that now might even be more routine than it once was. Do you feel hopeful about where that technology is going and catching, especially given different, breast tissues and what else is out there?
Yes, for sure, we're always evaluating what's going to be the best technology to do two things. We want to make sure we find cancers. We want to make sure but we also want to make sure we don't find a bunch of things that lead to additional biopsies that maybe weren't necessary. And so I think 3D mammography has been very good at doing that. And there are certainly other technologies that are out there that we're always looking at to try to see if we can't improve our screening for patients.
And you talked about, some of the things you can do, and we're seeing some of it on screen in terms of exercise and health. There were certain cancers in the study that talk about being obesity related. And I think, I don't know the stats, honestly, in terms of, baby boomers to Gen X and millennials about, what else is out there. I think there's a lot of, different ways to try to help people get healthy now. However, the obesity rates, we have seen them increase. Is that something that you talk to about your patients, just in terms of trying to stay as healthy as possible for people down the line, to be prohibitive against cancer, making sure that you're having, healthy maybe weight or having healthy diet?
So yes, I think it is important to talk about lifestyle modifications. We know that patients that gain weight during breast cancer treatment tend to have worse outcomes. And so it is important to talk about, in addition to just the treatment of cancer, to really kind of think about, the lifestyle part of it as well. It's all important and all plays a role.
And in the study, one more thing I want to point to is it did talk about how mortality rates had also increased in certain cancers. So not only the prevalence of it, but also possibly, mortality rates, I think it was 1990 to about 2019, in death rates. So does that something that worries you, that we're seeing not only the increase, but also potentially many more people dying from these cancers?
Yeah, I think it's one that's probably going to require a deeper dive into each one of those to try to figure out for each one.
Sure.
Real and what the etiology is. We have more options to treat cancer than we ever have. So I think that's a really important thing to take away.
Yeah, it seems like this study is really a jumping off point for a lot of other studies to sort of come about, and maybe tailoring research, I guess you'd hope, to some of the findings. Is there anything else out there right now that you are looking at in regards to studies, whether in regards to new technology coming down the line, that you think is also optimistic about what you're seeing right now in treating cancer?
Yeah, I never cease to be amazed at how much progress we make. From the time I finished fellowship 15 years ago to now, we have so many more treatments for melanoma that we didn't have back then. We really had one option after surgery. Now there are multiple. Same for breast cancer. Not only are our treatments better, but they tend to be less invasive. And so, never cease to be amazed at medicine and what we're able to do.
Well, that's great to hear. And the other thing I did want to ask too is you've seen screening ages go down, in the last 15 years. Has that made a difference at all in your practice in seeing, maybe earlier detection, seeing people have higher success rates?
I do think we see a lot more earlier disease by nature of these screenings. And so, hopefully these are people that by finding early disease, it allows people to make choices about how they want to have treatment, and hopefully sets them up for the future. So yes, I think it has been helpful.
Absolutely. Is there anything else in this study that really stood out to you as something to address to the public, or something to have people keep in mind, throughout their day, throughout, them keeping up with their doctors? I mean, anything that really stood out to you?
No, really the biggest thing for me in reading this was just calling attention to the fact that these numbers are going up. And so being in tune, having a primary care physician, so that if something doesn't seem or feel right to you, that you can have that conversation with them about. But that they can also talk about how to minimize the likelihood of developing cancer by improving one's diet, avoiding those things that may cause cancer, and then making sure one hits appropriate screenings.
And I know that Sentara, they've made steps, and I'm sure in the peninsula, with accessibility, in terms of now we're seeing, mobile mammography, we're seeing people be able to get out in the community and sort of highlight these issues, highlight resources. Is that something that is important to you?
It definitely is. Having access and being able to get in for a screening mammogram, or if somebody feels something, to be able to get in for a diagnostic mammogram in a timely fashion is important, because nobody wants questions to be out there lingering. And so we really try to make sure that we're available and accessible for people that have questions or concerns about their health.
Absolutely. Well, Dr. Wilson, thank you so much for talking about this. I think you definitely, at least for me, seem to have alleviated and left me feeling a little bit more hopeful, even with, some what the study might suggest. I have been looking in the chat, at least on Facebook, and, I think people seem not surprised with the results, but nobody had any other questions that we were not able to get to. But is there anything else that you wanted to add on before we end our segment today?
I do not, other than just thank you for the time.
Absolutely. For anybody that wants to learn more about what the study says and hear the conversation, hear what Dr. Wilson has to say, please, if you're watching this later, go on WAVY.com. It'll also be available on YouTube and Facebook. You can read the full study again at that link at the website and see what the American Cancer Society found out. But Dr. Wilson, thank you so much for coming on today. We really appreciate your time.
You are very welcome.